What is bladder nerve trial stimulation? Have you ever wondered how doctors help people with bladder control issues? One interesting method is called bladder nerve trial stimulation. This procedure is both diagnostic and therapeutic, meaning it helps evaluate and treat problems with bladder function. The main goal is to electrically stimulate specific nerves that play a role in controlling the bladder. There are two primary types of bladder nerve stimulation: percutaneous tibial nerve stimulation and sacral nerve stimulation. Let's start with percutaneous tibial nerve stimulation, often referred to as PTNS. This is a non-surgical outpatient treatment mainly used for symptoms of an overactive bladder. During PTNS, a thin needle electrode is placed near the tibial nerve, located at the ankle. The doctor sends electrical pulses through this needle, which helps modulate abnormal nerve activity related to the bladder. This can reduce bladder spasms and the feeling of urgency. Typically, patients undergo about 12 weekly sessions, each lasting around 30 minutes. Many people start to notice improvements after about 5 to 7 weeks. PTNS is generally safe, with minimal side effects. Most patients describe feeling a tingling sensation in their foot during the treatment. Now, let's talk about sacral nerve stimulation, also known as SNS or sacral neuromodulation. This method is a bit more invasive. It involves placing a thin wire temporarily near the sacral nerves in the lower back, which are responsible for bladder and bowel control. This trial phase can last a few weeks and helps determine if a permanent device should be implanted. The permanent device acts like a small pacemaker and delivers mild electrical stimulation to the sacral nerves. This can restore normal communication between the bladder and the brain, improving symptoms like overactive bladder, urinary incontinence, and urinary retention. If the trial is successful, the device is surgically implanted for long-term relief. From the perspective of bladder health, bladder nerve trial stimulation is a minimally invasive option for managing bladder dysfunction. This can be particularly beneficial for patients who may experience issues due to benign conditions or nerve damage from bladder cancer treatments. While it does not treat cancer itself, it can significantly enhance the quality of life by addressing bladder control problems. As with any medical treatment, it is essential to consult with a healthcare professional to determine if nerve stimulation therapies are suitable for you. They will consider individual factors and potential risks before proceeding. In summary, bladder nerve trial stimulation involves temporary electrical stimulation tests that assess and potentially treat bladder control disorders. These trials help guide decisions about longer-term treatment options aimed at improving bladder health.